Right. All right, Vic, you ready?
Ready.
All right, welcome to Whiskey, Wine, and Spine, where life is a sport, and I forget the tagline every week. Welcome.
Life's a sport. We're here to help you perform better.
That sounds right. Good job, Winnie.
Thanks.
Okay, so this week we are talking about 4 ways to perfect your squat, and I made sure when I announced this that this is hi Dad.
Tony.
Yeah, you're watching it live. You're staying up late enough.
Tony.
So that just made my day. So yeah, we're talking about 4 tips to perfecting your squat, and I made sure when I announced this that this was something people knew was meant to help people who even aren't athletes, because Vic and I talk about this all the time, that even if you're not an athlete, you still have to squat, right? And I mean, the number one example of this is, do you still poop? Right? That's a squat.
That's her favorite.
That's my favorite.
She could use anything else. Sitting on a couch, sitting on a chair.
You have to get up and down off the couch. You have to pick things up off the floor. You have to still perform all of these movements, and the foundation of them is a squat. So this is an important conversation for even someone who is not an athlete, and just the mobility and stability you need in your lower body in order to perform that movement successfully.
Yeah. I think a lot of times, I think it's old school. If anyone tells you that you can never squat again, I would challenge that always. I get a lot of those people that are, there are certain doctors, and I'm not going to name the specialty, that may or may not tell people that you can never squat again because it will ruin your knees. And I hate that, because it's not necessarily true. A lot of times I get patients that they went hiking for a long time and they're not hikers. They went to Colorado, and then their knees started hurting after walking 13 miles up a what are you doing?
I'm just putting the laptop up so we look a little better on this one.
Yeah, remember there's 3 cameras, so we're trying to figure that out. But they walked in up a mountain in Colorado 13 miles and whatnot. So the point to that is you probably overstimulated the muscles in and around your knees, including the joints. But the fact that you should never squat again, quite literally, I think is bullshit. Now, go find a qualified chiropractor or physical therapist, or go get a second opinion to see if that's true or not. But don't just go and someone tells you that you should never squat again, and then you go squat. That's probably not a good idea. But
yeah,
we want to find out why you're having that knee pain. So.
So I think our plan is to start from the top down, and the first area we want to discuss, and I'm gonna harbor in real big on this, is your breathing. That is number one skill. We're gonna kick off by talking about for your squat, and I'm gonna just jump in with some core and pelvic floor stuff here, and then you can kind of add your 2 cents if you don't mind.
Yeah, I'm gonna before this, I'm gonna say this 1,000 times during this, because I want people to remember this is the way that you should move. You should breathe right, move right, and then load right. So now we're talking about breathing.
That's beautiful. Yeah. So breathing, right? Most people know what this is, but diaphragm sits right underneath the rib cage. Okay, it's that dome-shaped muscle. Pelvic floor is at the bottom of the pelvis. And actually, I have my pelvic model. I don't know if you want to bring that on, how technical we want to get. But the diaphragm and pelvic floor play off of one another during breath. Okay? Yeah, here. My blankie in here. So pelvic floor, diaphragm, they play off of one another during breath. Okay? And then on top of that, you've got your transverse abdominis, which wraps around that corset muscle. Okay? And that's also helping you responsible for expelling air while you're breathing, especially during a really strenuous athletic event. Okay. So that being said, if you're recruiting muscles in your neck and, your scalenes, your traps, your levators, your pecs, in order to breathe, your squat is going to be screwed from the get-go. Okay. That's going to be a big issue again from the beginning, because the muscles, the diaphragm, pelvic floor, and that transverse abdominis are going to be responsible for that spinal stabilization during the squat. And a lot of people, when they get, what happens is they get under the bar, or even with a dumbbell or whatever they're using, right? They start and they take a big breath in and they hold and go down, right? And what that does is that creates a kind of a pressure system in your abdomen, right? Putting, again, all the pressure down on that pelvic floor and out against the transverse abdominis, and not allowing those muscles to function properly, and instead just really contracting them like as hard as you can with pressure, instead of allowing them to work and stabilize.
Yeah, I think a few things there. What she's talking about as far as like the muscles up here, as far as like helping breathing. If you look at smokers, for example, they have a lot of hypertrophy or growth in the muscles of like the scalenes, stuff like that, because that when they're having trouble breathing. So because of that, and a lot of people are like this anyway. But what she's talking about is the way that you should lay on your back, put your hand on your chest, put your hand on your belly, take a deep breath in. If your chest goes up before your belly does, you have paradoxical breathing. All that means is that your breathing pattern's off, right? Your chest really shouldn't move that much. And if it is, that's an issue. So if you're taking a deep breath, right? So a big thing that people don't realize is what the belt does. And so they just start wearing belts to increase stability of the lower spine. A prerequisite to that belt is knowing how to breathe correctly, because if you are breathing wrong, let's say you do have a belt and you breathe wrong and you go like that, you're not doing anything for the belt. The belt's pointless at that. Now, what the belt does is it starts here, and then when you take a deep breath, your belly comes out. The transverse abdominis, really just the abdominal wall all the way around, just your entire core. It goes out. The belt restricts that to the point where there has to be an increase of the pressure inside your abdomen, then creating more stability because there is more pressure there. So that, I would say that's if you're wearing a belt, try to take a deep breath and make your belly come out. That's really it. That's a proper
push against the belt.
That's yes. I want you to push against the belt. But it's a great thing if you learning how to breathe right seems so slow and it takes patience. But I'm gonna breathe right, move right, load right. This is how I do my rehab. This is how I do my fitness.
Yeah.
If you can't breathe right, why am I going to put you under a barbell and do squats? Why am I going to put a belt around you and see how much you can squat? Because at that point, literally, if you think about it, based on what I just said, if you can't breathe correctly, you are putting your lower spine at more risk in making me look bad as a coach or a doctor. So we need to make sure that you're breathing correctly. Now, it doesn't take that long. There's a few exercises that you can do, including the one where I told you, laying on your back, 2 hands, one on chest, one on belly, and learning how to breathe like that. But yeah. That's, breathing is definitely going to be a big part of squatting correctly. And that has to do with the motion, but mainly has to do with proper stability in the areas that need to stay stable versus mobile in other areas.
And we're gonna get to this, but and again, I'm gonna harbor on the pelvic floor here. But that pelvic floor, because it aligns the inside of the pelvis, it at times acts as an antagonist to the glute. So what that means is that if your breathing pattern from the diaphragm and the transverse abdominis is wrong, then your pelvic floor isn't kicking in when it should be to stabilize, and therefore the glutes aren't getting the right feedback that they need to kick in. And we're gonna talk a little bit more about the glutes later. But that pattern, just from the top down, if diaphragm's not functioning right because these are overactive and the scalenes and the traps and all these muscles that are being recruited, right? Then you've got that cascading down to the transverse abdominis not working correctly. And then therefore the pelvic floor and therefore the glutes, which most people do squats, or women at least do squats for their glutes anyways, right? So if you can't breathe, it's going to affect your glutes in the long run, right? It's not something, just learning how to breathe because, Peyton and Kelsey said to, right? It will literally impact you from the top of your your spine and your chain all the way down to the muscles that you're actually trying to target that can't function properly.
Yeah. Whenever we're talking about breathing, it's obviously due to like one big reason is to make sure that you don't become hypoxic, also known as not enough oxygen in the body kind of thing. But mainly what we want you to think about as far as squats go is when we say breathing patterns, we're talking about where you're inflating and deflating certain parts of the body to enable you to become more stable and thus properly mobile in other areas. So don't think about, that's the best way I can put that. Next.
All right, next is the hip hinge. Now, when we first started talking about this topic, Peyton brought up a really good point that the squat is a knee dominant exercise, and we went on from there. But
Mildly, but
I like to argue when we talk about squats that even though it is technically a knee dominant exercise, I much prefer to teach a client or a patient how to hip hinge before I teach them,
I would
or
too.
not hip hinge, sorry, to deadlift before I teach them how to squat, because the deadlift is the primary exercise for the hip hinge. And while so many people, we talk about the squat as being like the functional movement, and I started it off by joking about you need to squat because you need to poop and you need to sit down and you do all those things. The deadlift, I think, is a movement that people, in its purest form, like if you see something on the floor and you go to bend down and pick it up, a lot of people won't perform a squat or a shitty squat. They'll perform a shitty deadlift to do it, right? That's just what I see as the natural thing, is if I see something on the floor, I kind of hunch forward to go pick it up, right? I don't actually come into a nice, deadlift to do it. I don't even come down to squat. I just bend forward to do it. So
does a straight leg deadlift.
Right. So I would much rather see someone learn how to deadlift first and perfect that pattern. So that way, when they go to do those tiny little repetitive movements, they're more apt to get into a deadlift pattern than a shitty deadlift pattern. And then from there, work their squat.
Yep. I do things differently, and not to say that that's wrong. I just do things differently. Both deadlifts and squats are both knee dominant exercises. Now, if you want to talk straight leg deadlifts and stuff like that, as far as a hip hinge go, I get people and I put their ass on a wall and I have them take a half step out, and I'm like, all right, don't bend your knees. I want you to come back until your butt touches the wall. And they do that. And I'm like, all right, take another half step out. And they kind of keep doing that. And that's the best way to teach that hip hinge. If I'm planning to do squats with that person, I will regress them doing squats, meaning, I'll do body weight squats, body weight box squats, and then, go to like landmines, kind of build up from there. Very much because they are kind of two separate things, and you can easily kind of mess up on a deadlift versus a squat. And that's just me. Again, not to say that, it still works. 100% that still works. Not to say that that's anything there, but as far as anything else goes, hip hinge is huge. And the main reason why we're talking about that, it is a knee dominant exercise by, I don't know, it was like 5 or 10%. When I mean that, we're talking activation of muscles in the hip based on like glutes and like the quad. So quad dominant, knee dominant type situation as far as like EMG is concerned. So there's that. But hip hinge is huge because if you don't, so there's that. But hip hinge is huge because if you can't hip hinge, if you can't bring your hips into flexion, I can't really.
If you can't bend forward.
If you can't,
from your hip.
If you use your hips to go like this, then your lower spine has to compensate. That's the way that it works. If a joint is restricted, the above and below segments have to move more to compensate in any situation. I don't care if it's your finger and your wrist or what. Now, so that's kind of the biggest thing that we have to talk about as far as like the hip hinge is important to protect yourself. I would say that's really the biggest portion of that, at least in my eyes. Mainly one, because I'm a doctor and I've seen so many people squat and deadlift terribly. It's bad. But hip hinge is really important. So breathing correctly to protect the spine, and hip hinging correctly to protect the spine.
Yeah, and I think too,
yeah.
like you see some people with just shitty ass squats. Like it either looks like a good morning, right? Or like you know what I'm talking about? Like when someone goes to squat and it's just like they don't really get to depth, and like the hip hinge is more lower back, so you get that kind of booty, like a tuck thing going, and it just kind of looks like a good morning, right? And then they stand up and it's like that's their squat, and they really don't have, and we're going to get into the glute function a little bit too, but that it's really, when you see that, it's a lack of ability to hip hinge properly.
Well, okay, so a few things there. When we say hip hinge, I don't want, unless we're talking straight leg deadlifts or good mornings, which if you're doing good mornings, stop. But if we're talking hip hinge, I don't want you to think chest down, because I think that's I think that's a good point that we just mentioned. Because technically, if my legs are straight and we're talking hip hinge, and you're doing it correctly, your chest has to go down. But we're talking about squat, which is a multi-joint exercise. We're bringing in the knees. Mm-hmm. The idea here is we want to try to keep the spine like this. Mm-hmm. Is that possible? Probably. I've only seen one person do it, and it was a classmate of mine, and she went like straight down. That was Joe that did that, or Chow that did that. So
is this making sense to you guys? Just shoot us a
comment. Or if you have questions or anything.
Anyone has questions, just shoot us some feedback if you.
Yeah. So proper hip hinging is important to not only protect the spine and keep it from going into flexion, but to try to keep the spine more level. I see a lot of people and they do squats, and whenever they do squats, they go like this, like their upper back, their legs are down here, and whenever they come down, they go and they go like this, and you could be talking specifics about a high bar and a low bar. Low bar, definitely going to do that. Who should be doing low bar? People who compete in low bar. Everyone else, you never need to do low bar. So probably stick with high bar because it's safer. I will never do that.
Yeah, I mean, I squat low bar for sure. But I mean, for me, like my upper body, and I think a lot of women go through this, right, is that their upper body, if you're hypermobile, to be high bar is just too unstable.
Maybe.
Right. And that's where I know I'm at, and a lot of other women are in that position as well. When they put a bar on their back, it's just high up is just too unstable.
Maybe.
But again, that just all depends on the person.
Yeah. And here's the thing. I used to think that. I used to think exactly that. And it wasn't true. And now my back is blown. And that's just me. And that's just the way that I speak. And if it feels more stable and you're good and there's no pain, then like have at it. But like, as far as if someone asks me a question and they're actually do high bar or low bar, no one should do low bar to start off with. No one should try to do low bar to start off with. Now, if I put someone in a position and no matter what I do, low bar is better technique and they have less pain and they look better and they're getting better results, guess what I'm going to do? I'm going to do low bar. Rare. Y'all, that is unbelievably rare to do that, but it is what it is. The point that I'm saying is if I get, the 17-year-old kid over there he's never done squats in his life or he's been doing them wrong, I'm starting off on high bar and I'm going to focus on the high bar because technique-wise in 90% of the population will be better off on high bar. So hip hinge, breathing and hip hinge.
Next, our third one is the actual function of the glutes in all of this. So this was really interesting once we started talking a little bit more about what we actually want to see the glutes perform or do, right? And Vic brought up when we had first started talking that a lot of people want to see, like, people will say things like, oh, when you squat, you want to see your knee go outside of your big toe, or, those kinds of things. And to be honest, that's all bullshit. Like, that's all just total bullshit. It's really going to depend on the person. And when you're talking wind down for this, we're getting serious. So when we're talking so this is your thigh bone, right? Your femur here. And this is going to be the hip socket. Okay. Depending on the shape of that hip socket, you may or may not have enough range to get your hip into the position that would allow it to get the knee over the toe, right? Some people might not have that range. And then other people, they might only feel comfortable with their knee on the outside of their toe, right? But it's not necessarily a requirement to squat or something that you should be looking for even when you squat. And I'll let you really dive into this a little bit more. But what I really like that Vic said when we were talking about this is that, I had brought up the function of the glutes as their rotation function in the squat. And he said, well, when you think about it, it's really anti-rotation, right? And that was a concept that I never really thought about, but it's true. You want your glutes to be functioning as we're holding you in this position and we're staying in this position throughout the course of the movement, right? So yeah, if you want to dive into that a little bit more.
Here's where I come in. This is my specialty. We're talking about pelvic floor and stuff. So this is me and the function and how things kind of play out. So what we're talking about is whenever you're doing squats, you see people. I did
move the table from him this week so he can't slam it.
Thank you. What we're talking about is when we're doing. Now I lost. Sorry. What we're talking about is whenever we're doing squats and whatnot, what we're talking about is knee over toe, which 98% of the time is true. Because if your knee is going over the toe, we're talking about lining up with what your hip socket is doing. So a lot of times there's genu valgum, which is whenever you do squats, your knees come inward. Hopefully everyone knows what I'm talking about. If you don't, send us a message. But whenever you're doing squats,
it's like a not
you come in, and whenever you're coming back up, because of weak external rotators, your knees collide inwards like this, and then you come back out. So here's the thing. She was talking about in the beginning of it, and she's not wrong, but this is where I challenge some things, and we kind of go back and forth, and we use our brains and our specialties to kind of figure these things out. If you're doing squats and you're coming down, I don't want you to think about external rotation. I just want you to think about having your knee going over your toe. I also don't want you to look at your toes, because a lot of things. Because if you look, but here's the thing: like if you're, I don't want you to focus on your toes. Everyone's going to look at your toes. That's fine. My right toe out is farther than my left. Is anyone going to come and tell me that that's wrong? Probably some personal trainer somewhere is going to come over and say, you need to be absolutely symmetrical. Nothing in the human body is symmetrical whatsoever. I literally, structurally speaking, my right hip will externally rotate more so than my left. That is a bone socket situation that has nothing to do with my muscles, no matter what I do. How do I know that? Because I'm a doctor. I know how to test that. But so whenever I'm out, my right toe is out farther than my left is. So I want you to focus there. Okay. Now I want you to focus on anti or internal rotation, because technically whenever we're doing squats, we're not doing squats and then our toes are like this, right? And then as we squat, then we're starting to go into external rotation. That's not true. What we're doing is starting in external rotation, also starting in what I would consider is probably more like a hip neutral, okay? Mm-hmm. Is where your hips are kind of just, they're not here, they're not back here, they're just in kind of neutral. This will look more so on a toe out situation. Whenever you're doing squats, you need to focus on anti-internal rotation or anti-knocking your knees together. Mm-hmm. Another thing is we say glutes a lot. If you look into the anatomy of it, there's 3 glutes, and there's a piriformis, there's a superior gemellus, there's all kinds of muscles underneath the glutes that have different things going on. Mm-hmm. Gluteus minimus is an internal rotator. Gluteus medius is an external rotator until your hip is at a 90-degree angle, in which, based on its insertion, can turn into an internal rotator. Mind blown. This is why it's so unbelievably important. Whenever you're doing squats, whenever you're focused on, well, I need my external rotators to be strong so I don't knock my knees, so I don't go into internal rotation. This is why function is really important, because if you do clamshells all day long, I'm looking at all these cameras, if you do clamshells all day long to strengthen your glute medius, because they're a very, very strong external rotator, and you don't actually strengthen them and work on the form as you go down into a squat, which is more neuromuscular re-education of the whole thing. If you're doing that, then if you're only focusing on the strength of that muscle, by the time you hit 90 degrees, that glute B that you've been strengthening is still going to be strong and going to go from external rotation, go to 90 degrees, and it's going to pull you right back. And they're going to wonder why. I'm working on my external rotators. You have to focus on, if you want to get better at squats, squat. You need to squat. Now, again, we can talk about like accessory movements, which would be like more clamshells. And then I would argue more of like a straight leg, like a single leg, straight leg deadlifts would be better off as far as the function goes from a glute med. But as far as like function goes with the squat, and as far as the glutes, you need to think about where you want your hips to be and where you want your hips to stay based on angles, not necessarily hip hinging, but based on angles.
I think too, anti-movement is just a function in the body that we don't train frequently enough, and we don't really regard as important enough. I just think that's something that is very commonly overlooked.
Unless you're on my program,
is anti-movement or anti. Right, because even like certain core functions, we were just talking about the core and the transverse abdominis and the diaphragm and pelvic floor, all of those movements, right? It's not a lot of time that they need to, especially the pelvic floor, right? It's not a lot of time that we need to produce movement, but that we need to resist movement, right? That it needs to be strong enough. And how many women out there, when they sneeze, right, they urinate a little bit, right? And that's due to weak pelvic floors and, all of those issues. That's due to a lack of anti-movement, right? It's not that it's not moving enough, it's that it's moving too much. So
yeah,
it's just anti-movement is definitely underrated.
Yeah, it's definitely, and so I don't think a lot of people understand it. Planks are extremely popular, and I think people are trying to get whenever they think planks, they're trying to get stronger in flexion, when in actuality a plank is anti-spinal extension,
right?
And just people don't know. They're extremely popular, but a plank is an anti-extension workout. And if you look at the rectus abdominis, this comes down to the argument of action versus function. Action-wise, what does that muscle do? It flexes the spine this way.
Yeah.
Function-wise, as far as even when we're talking about the glute med, I'm not going to get into that again, but these muscles have actions versus functions with the rectus abdominis. More so as far as an everyday life, which is what we're talking about. As far as everyday life goes, is an anti-extension muscle. It keeps you from just like straight up like falling backwards.
Right.
It keeps you upright. Because what are you doing all day? You're standing like this. You're not going whoop. You're not like, the gravity's here and there. So if you go here, you're not using that muscle. More so, you're using that muscle to keep you from resisting the gravity from pushing you back that way. So
it's like a teeter-totter.
Yeah. So
it's literally like a teeter-totter.
So as far as like, this is where my programming is much, 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 much different than most people, because I am function oriented. A lot of my movement patterns have to do with, I have strength going in one direction. I have anti-movement patterns coming in another direction, stabilization techniques, unilateral versus bilateral. If we're talking farmer's carry, if we're talking Pavlov press, how long we're going to do that, breathing pattern. That's kind of where, as far as function goes, and that's really what this podcast is about. Now, if you come to me and you're a golfer, we might change some things that might be different. But as far as the everyday person, this is really what we need to hone in on.
Yeah. And, a good thing, and, one more thing on this, and then we'll move on, because we could really go on forever in case anyone hasn't noticed. But another really good example of anti-movement is, for me at least, just from a functional perspective, is when I lived in New York City, being on the subway in New York City. You good?
Hi, Whitney. Love your question. I'll get to it. Or we'll get to it.
Being on the subway in New York City, you realize the importance of anti-movement, right? Because a lot of times you're standing, you're not sitting, and you're holding onto a bar or whatever, and the subway is just dragging you one way or the other, right? And it's like you never really think about it, but it's like there are a lot of times you get off the subway and you're like, shit, I'm freaking sore from riding the subway,
Yeah.
you know? And it's because a lot of times in our movements and the way we train, we're not programming to resist that movement, right? Like we're not programming when you pick up your kid or your dog or whatever, you're not programming for your spine to resist the movement that when you're bringing that thing up from the floor or down from a cabinet or whatever, we program movement, right? So if you're not programming anti-movement, you're missing out on a huge, huge, huge portion of functionality.
Anti-movement is largely based on stability. Athletes tend to be different based on, so if I have a baseball player and they have to kind of twist and throw, then my programming for them absolutely 100% will be different than the average mom or average dad or average person, because they have different goals. As far as everything else is concerned, a lot of that anti-movement is to protect, to put things in perspective. If I see people doing planks sometimes. This is kind of a new fad, I guess. I don't know why. I don't understand it. I kind of understand it, but I also don't understand it. They do planks, but they drop their hips to the floor. They do this, and I don't. Why? And I just don't. I like to the average person reading Men's Health in Justin Bieber's 6 Easy Steps to Six-Pack Abs. That's my favorite quote. But to the average person, here's the thing: you are loading the muscle, you are working the muscle, so why not do it? Because you don't do that on an average day. Your muscles don't do that on an average day. You don't do that on an average day for the most part. As far as the spine and the core is concerned, to the average person, largely it has to do with stability in resisting whatever is coming to the spine and making sure that, because if the muscles can't control what's going to happen, then the spine's going to have to take a huge load of that, and you're going to end up getting facet syndrome, disc herniations, bulges, eventually probably getting osteophytic changes, or bony changes, and things like that. So those are big as well. So and we want to train the muscles to cooperate together, because low back paraspinals, para meaning beside, spinals meaning spinal, so the muscles, the back straps that are right next to the spine, are definitely going to automatically, anatomically and genetically speaking, going to be stronger than the rectus abdominis. So we need to create, we need to train the muscles to all be equal to create the best stability, and let them do their jobs based on their function, not necessarily only their action. Not to say I'll never do the action, but to focus on, functionally speaking, what does your spine need help with? What does the rest of your body need help with?
Do you want to talk about the butt wink now, or do you want to save it?
Do we have one more?
Yes. That was on 3.
You can say it. She can say it. She doesn't have to.
Well, I don't know if you want to talk about her question first.
Well, no. Let's stay on topic, because then we're gonna get lost.
Okay. So our 4th one, and they're all really important. I don't want to say this is most important, but
it's a movement. None of it is more important.
No, but it's just so crazy to me. So our last one is ankle mobility, and I'm not going to say any one of these is most important, but I will say if your ankles are jacked, nothing is going to go right for you. And there have even been studies that link trigger points in your calf to pelvic floor dysfunction. And I will say
and low back.
And I will say there are so many people, and you know this from practice and from what you've learned being in the practice that you're at, that trigger points in the calf mess you up. And ankle mobility is something that I think we just don't even fully understand the impact it has on your overall ability to produce quality movement. And I mean, there have
underrated.
even, it's so
It's just
underrated.
underrated.
And there have been so many studies that even link ankle mobility to migraines. Like, how crazy is that?
Yeah, there is one single piece of fascia. This is incredible to me because this is a really big deal. A lot of people may or may not think that this is a big deal, but this is a huge deal because there's a lot of new research coming out about fascia, which we had no idea about fascia. And there is one piece of fascia, one piece that goes all the way from here, from your EOP,
Back of
your
your head.
external occipital protuberance, if you want to be fancy,
Back of your head.
all the way down to the back of your heels.
Mhm.
Right. So here's the thing. I don't know if, because I've only seen 3 true migraines. Everyone calls it migraines.
Mhm.
I don't know if it's true migraines, but the point that she's trying to say is like ankles are extremely underrated. We don't focus on them enough. We don't look at them enough. We don't pay attention to them enough. We don't give them enough love or the muscles around them.
Yeah. And it's like when people started to freak out about gyms being closed with their like quarantine fitness and like, oh my God, what am I going to do? Like stretch your damn calves. Like,
Yeah.
you know, I
Go
mean,
watch
that's
our.
like,
Was that the first one?
that was our
That was
first
our
episode.
first
Was
episode.
quarantine
Go
fitness.
watch our.
And-
Go watch
But
that.
you know, there's so many little things like that you hear it and you're like every time I feel like I read something or we talk and I learn something new, I'm like, shit, I have so much to work on, you know? And that's like where my brain goes, is that like, that there's just so many things you can do to improve your fitness when you think about it. And something like ankle mobility and breathing, I would say, you know, again, the hip mechanics are really important, but breathing and ankle mobility are going to have the 2 biggest effects on your fitness level if you can improve them properly. And I'm going to go out here and say, just tying this in, because we have talked about this before too, but being overweight is then also going to impact your breathing patterns and your ankle mobility, right? So like controlling the weight, controlling the nutrition, and fixing those functional deficits are key to that.
Yeah. Has anyone ever wondered why people who do squats wear shoes that have a lifted heel? Why do they do that? It's in the foot. The point
Didn't your
is,
mom ask you that a couple weeks ago?
yeah.
It was really cute. I liked when she asked that.
What? My mom is
She's so
the
sweet.
sweetest, smallest woman on the earth, and very innocent. She knows a lot about a lot of things, but
Squatting isn't one of them.
No. So the point-
it was really
so like people wear shoes with higher heels, including myself, to protect the spine and make things easier there.
Mhm.
Ladies, get your heels on because I want you to try this. I want you to put heels on, and I want you, first of all, don't do flat-footed. Do a squat. Take a video of yourself from a lateral view so that you can see yourself not frontal but on the side, because I want you to see how much your back will come this way with flat foot, and then go put your heels on and watch how easy it is for your spine to do this from your feet. Ankle mobility is incredible, because what we're doing, this is if this is your foot, okay, this is dorsiflexion, this is plantar flexion. You can remember that because plantar fasciitis, that's the bottom of your foot. If we're taking away dorsiflexion and we're going like this, that's one angle we're able to take away. So if we can take away that angle, it's easier for your spine all the way up the chain to become more straight. Likewise, if you want to put the balls of your foot on, I see some people putting their balls of their foot like on like a 10-pound weight so that their heels are on the ground and their feet are up. Don't do that. That's pointless. Don't do that. But it's better to do that as far as like technique goes. I use them all the time. I wouldn't necessarily recommend them for every single lift. Unless you're a person like me. I have broken my lower back in 2 places. I have broken my neck. I structurally have an issue, so whenever I squat or deadlift or do anything like that, I almost require a shoe like that because it's safer for me. Now, you don't have to do that every single time. You definitely can, but you know, just something to think about as far as that goes. But yeah, ankle mobility is a really big deal. We talked about in the first episode Can't go to the gym, so now what am I do? It's a great time for accessory movements. It's a great time to work on ankle mobility. A lot of times mobility in general is extremely malleable, because if it's not necessarily the joint itself, it has to be the muscle. If it's the muscles are very malleable, right? You can stretch them, you can strengthen them, you can do all kinds of stuff like that.
Yeah, and I think a really cool thing about ankles, and I don't want to put my feet on here because I don't have pedicure done lately, but like if you put your foot just out, like if you just hold your foot out, you'll actually see the resting length of your calf, right? So like if you just look at your foot, and like I'll put my foot here, like you can see my foot is kind of pointed, right? My toe is slightly pointed. So, you're going to show my feet. I hate you. So, if I'm looking at the rest of them. If I'm looking at my foot, right, like it's not perfectly plantar or dorsiflexed, right? It's not in the position it would be in if I'm walking, right? It kind of stays pointed. It stays kind of, again, if this is your foot and this is how you would walk, right? My feet, when I get off the ground and laying down, my feet kind of point like this, right? They don't sit like this normally. So, it's just, you think about that, and that really shows you, if you just look at your foot, just look at it. That shows you the resting length of the calf and where your weaknesses lie. So if that's the resting length of my calf, what's going to happen when I stand on the ground? When I stand, I have to force that foot into dorsiflexion, right? And now if I want to go into a deep squat, I've got to further force it up, right? I've got to further force that dorsiflexion to happen. So it is just way more complicated down there at the foot level than I think a lot of people realize or appreciate.
100%. Squats start at the bottom. It is a closed chain exercise. Closed chain means, so like if you're doing, so like a leg press is an open chain. Is it an open chain? Is leg press an open chain?
Open chain. Yeah, I agree with that.
I think I had a debate with that. Anyways, yeah, I guess for now I'm not 100% on this, but so open chain, leg extensions, right? And the reason why I know that is because your body is sitting, your body's not doing anything, but your legs, like your feet, are moving. Okay, so squats are different because your feet aren't moving at all, but the body is. So closed chain versus open chain. Squat is closed chain. Everything starts from the feet, position wise. Why? I mean, every time all thing you got to do is like position the bar on. Once the bar's on, the bar's on. Everyone kind of has to situate themselves whenever they get ready to go, and then they have to squat. Why is that? Because everything starts from ankle mobility. Ankle mobility is huge. It's overlooked. It's underrated. It could help a ton. It's great for warming up if you're doing squats. Deadlifts, lunges, anything. As far as I'm concerned, personally. But yeah.
Cool. Those are our 4. Breathing, hip hinge, glute function, ankle mobility. Those are 4. All right, you want to get to Whitney's question?
Word.
So Whitney has a question about the butt wink.
Whitney, by the way, I love you because you're always on here and you always ask questions.
She's the best.
It's amazing.
She really
love
is.
I love it.
She's the best. All right, so butt wink. Go ahead.
For anyone who doesn't know what butt wink is, I wouldn't say Google it off the bat.
Don't do that.
Just go on YouTube and type in like squat butt wink.
Squat butt wink is probably better.
What happens in squatting is, and we're talking about like sacral attenuation, but what we're talking about is whenever we get low enough, the butt kind of tucks itself under, or the sacrum tucks itself under. So there's a few things here as far as I'm concerned. If that's happening, it could be a multitude of things. It's probably muscular. Now, most of the time when that's happening, people are low. They're very, very low.
Or just too low for them.
Right. Well, they're low. Like that really, it doesn't happen at 45 degrees or 110 degrees or whatever you want to call it, but it happens below parallel, at parallel or below, I would say. I personally am not afraid of butt wink. I don't think it necessarily matters too much. The issue that I have with the butt wink is what happens above it. Because what will happen there is a lot of times, if you butt wink and your spine's good, I don't care. I really don't. If you butt wink and your lumbar spine is straight, and then your lumbar spine, whenever you butt wink, starts to do this, that's really where I have a big issue as far as squatting goes. I don't care about butt wink. So
I'm glad you said that.
Well, a few things there. And again, I program things much differently than most people. I don't care about ass to grass. I don't care about it much unless you're competing and you need to do certain things. I just don't think it's necessarily required, I guess, is the best way I can do it. I'm not going to say that I'll never do it. I don't require it. That's not my motto, ass to grass. It's not necessarily there. Not to say I'll never do it, but just to let y'all know where I'm at with that. I don't think it's there. Do you have to go to parallel? No. Does the butt wink cause you pain? Because a lot of times what will happen, trainers will see they'll read Men's Health with Justin Bieber and they'll see butt wink is bad, and then they'll see butt wink and then they'll immediately try to change you. A lot of times that's not necessarily like needed. Well, if you have something to add.
Well, I was going to say too, the other thing about that I'm glad you said is not like you said, what happens above it, but also one thing I find is that people who experience the butt wink, a lot of times what you'll see, and this doesn't always happen, but I find it to be common, is that people who butt wink, it's a very like, they get into the hole and then they like boop, boop, and they bounce back up. And that's a lot of times when you see that butt wink, because what they're trying to do a lot of times when you see that is the sacrum. So when Peyton said earlier, sacral nutation, what he means is you have that tailbone. Okay. It's that triangle shaped tailbone in your pelvis. That bone will kind of tuck under, right? And what happens is when your glutes don't function properly and the pelvic floor isn't functioning properly, and again, could be because of your breathing, right? And the whole diaphragm relationship we just talked about, but who knows why, when those muscles aren't functioning properly, you don't have like the scooping effect of the pelvic floor and the core to bring you back up without getting into the hole and then bouncing and using momentum. So if you're getting into the hole and bouncing and then using that wink to get you back up, there's actually a really deep inner core issue going on when you have that momentum effect to get you back up.
Yep.
And that tends to go hand in hand with the butt wink a lot of times.
So I would tell me if I'm wrong here, but as far as like functionally speaking, because I've done a lot of research on this as well, unless you are trained to do that bouncing and you have someone who is like coaching you and watching you, because bouncing is a ballistic movement. It's going to happen. A lot of times what she's talking about is people who don't know what the hell they're doing.
Yes.
And they're just using the bounce.
Yes.
Right? Okay.
Hi,
All right. Damon says hi, everyone. He's getting a little antsy. So as far as like the butt wink goes, structurally speaking, if we take all the muscles away, if you do enough hip hinge, which by the way, you're probably doing that, the pelvis it has to do that.
Right.
It has to. So like I don't really have an issue with the butt wink. I don't necessarily want to stay away from it. But I also want to I want to see why it's there is the best way I can see. If I see someone do if they're squatting and they have a toe out like I do, my right toe is externally rotated more than my left, right? We talked about that earlier. I personally, if I saw that and I was coaching, I want to see why. If I see it's structural, we're good to go. So if I see a butt wink, it doesn't mean that's bad. It just means I need to investigate. So it could be tight hamstrings. It could be weak paraspinals. It could be a weak glute max. It could be a weak piriformis. It could be a weak superior gemellus. It could be a weak glute min. I could do this all day.
Yeah.
The issue is the big question becomes, is it damaging? Is it dangerous? Does it cause pain? Do we need to stay away from it? Does the butt wink happen 10 degrees below terminal hip hinge, because that's easy to stay away from. Just don't do that, right? Like don't do that,
Right.
and like, start doing box squats, not necessarily because you need to, but to train your body to go to a certain depth. Because I think a lot of times people do squats, they either don't go low enough or they go too low because it's kind of a gray area, and people don't train their muscles to connect with their brain to tell them, yep, that's it. Yep, that's it. And you have to, this is why I keep talking about neuromuscular re-education, or just neuromuscular education. What I mean by that is literally consciously communicating the brain with those muscles, so that whenever there's a certain amount of tension in the hamstrings and the glutes and the paraspinals or whatever, that is a signal to the brain to tell you that's depth. That's depth. So I think for me personally, as far as like the butt wink goes, that's where I stand. I care enough to investigate. I don't think it's a big enough deal that people are making it look like. I care. Does it cause you pain? Is the form bad with it? Is there too much lumbar flexion? Yada, yada, yada. But as far as like the butt wink goes itself, it just makes me curious. Did you have two? Why do some people experience? Oh, hip shift swing when they're coming from body. Yeah, that's a good question. Do you have anything else to add to that?
Not really.
Okay. Her second question was, why do some people experience a hip shift / swing when they're coming up from the bottom of a squat? What I'm assuming, Whitney, and tell me if I'm wrong here, but whenever you're squatting, sometimes people's hips will like shift this way while they're trying to like come up that way. Do you want to start that one?
Oh boy.
Because I just talked for about 30 minutes on mine.
I need some more wine for this. Yeah, so a lot of times when you see that like that shift side to side, I'm going to assume that's coming from likely previous injury or weakness on one side. So again, when Peyton talks about neuromuscular education, that is huge, because your brain, like our bodies, and another thing Peyton says all the time is like our bodies are the smartest, stupidest things ever, right? Like if I have, I always say that my left ankle is my bum ankle, right? So for a while, without that neuromuscular retraining, my body will naturally shift over to the right side because your brain says, no, that's injured. Right. So depending on what's going on with your body will then try to avoid certain things or doing certain things to stay out of pain or to avoid pain. And that's most likely what you're seeing when that happens. Could it be related to some, again, inner core issue, or someone with scoliosis or something else going on where they're then coming back up and then out? And you see that sometimes too, like someone will squat down and then they come up and then back up like this, right? And again, a lot of times that's just avoiding a painful pattern from something that neurologically they're still tied to from their past injuries.
What she's saying is it could be due to 1,000 things.
Yeah, like it could be an ankle injury, it could be a knee injury. And actually there's a few patients and clients that I work with that have had those types of injuries. And a lot of times what I will do when I'm doing their programming and working with them is I will literally like take a band and say it's their left knee that's injured, right? I will stand on their left side and I will put the band around their right hip and I will pull them to the left and make them work through that squatting pattern while I'm holding that band and forcing them towards their bad side, because to them that feels off. Right. And I think anyone who's ever been to a chiropractor or been to a PT or been to a healthcare practitioner like that, whenever there's certain times where I lay patients down on my table and I say, they're face down, and I say, does this feel like you're straight? And they say, yeah, I'm straight. And I go, okay. And I straighten them out and I put them so their spine is actually straight where they're laying down. And I say, this is straight. And they're like, I feel like I'm so off right now. right? And that's because their brain has programmed them into thinking that their dysfunction is straight or is normal, and it's not, right? So that's kind of the same thing with that squat pattern where you see someone doing that zigzag, is that they're avoiding a painful pattern from a past injury. And a lot of times to get them to go out of that, you actually have to manually go in and force the patient out of that posture and that position. That's all I got.
Yeah. Could be due to 1,000 things. Let's say to answer that question, there's no pain, there's no previous injury. So I feel like that's probably most of the generation. A few things there. I want to tell you that symmetry is super important. That's different whenever you're talking about like movement patterns, obviously, because we want to make sure that you're going up correctly. But yeah, that's all that. But one thing that I was super focused on was symmetry with how I started my squats, and my feet had to be symmetrical. And on the way up, I was doing this kind of weird swaying pattern. And I remember one time I just said, I'm not going to look at my feet. And I just kind of like, I felt like what she was talking about. I felt like what I was looking at, what I felt was good and aligned. And I did it and I went back up and I didn't sway. And I looked down and my right foot was like that way. And my left foot was, more like that way. Well, not dramatic, but you kind of get the point. It looked that way. So sometimes it could be how you're positioned. Because if your joints aren't positioned correctly and you're anchored to the ground with a ton of weight on your back, your body's going to try to keep your joints safe. And the best way they can do that is use those muscles to kind of go around it and then go back up. That's one thing. Another thing is, like we were talking about before, as far as like the swaying goes, I don't want y'all doing clamshells all day, every day. If you want to work on, not swaying and whatnot, you need to induce squats, and you need to make sure that you're not, swaying like that, and slowly load as you go. So a few things. There's probably, I hate saying the word tightness, but there's probably tightness somewhere. There's probably there's dysfunction somewhere. Now I don't know if one side's stronger and one side weaker, because that's easy to say, but it could be a core thing. It could be a foot thing. It could be an ankle thing. It's difficult for us to say, because there's and I always hated when my mentors, Dr. Todd Riddle and Dr. Teeter, love y'all but hate y'all, because I'm turning into y'all. Love y'all for that and hate y'all for it. But their answer to every question that I had was, it depends. 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 So there could be a multitude of reasons for it. The easy answer here is muscle imbalance. That imbalance, I think a lot of people talk about weakness versus strength. One side's strong and one side's weak. If you want to dive into that, true weakness on a physiological level versus just not contracting the way that you want it to, is that true weakness? I don't know. Probably not. Right? I think it depends if there's pain. It depends if there's a multitude of things. But that's kind of where we're at. Keep poking Chiefs poking me. I guess time's up or something. I don't know. But that's my answer as far as the whole swaying thing goes. The best thing that we can do in that situation, if you're having that problem, is, again, to send us videos so that we can see and we can look at those things and we can talk to you and we can ask if there's pain, if you had any prior injuries.
We like videos.
So that's kind of where we're at. That's the end of our show, I would say. I think apparently we only have like 33
That's
seconds.
Why I was poking you.
No, I didn't know there was a time limit on these things.
That's why I poked you, because I knew you didn't know.
I don't know. All right, that's the end of our show. Love y'all to death.
Cheers. Thank you guys.
Yeah, send us videos and ask us questions, and we'll see y'all next week.
Bye.
Bye.